What is a perennial hematoma? A perennial hematoma is a collection of blood that has leaked from a burst blood vessel in the area around the anus. This blood pulls up outside the blood vessel below the surface of the skin. Although it is possible to see the characteristic blue discoloration by the naked eye, a perennial hematoma can be small or large. Perennial hematomas are sensitive to pressure, and the larger they are, the more sore they become. A perennial hematoma can also become more painful as the blood that shaped it starts to clot. A pregnant woman have higher risk of developing perennial hematoma. As the baby grows in the uterus, it puts pressure on the anus. During labor, increased pressure around the anus from pushing can also cause perennial hematomas.
For the ethiology and pathophysiology of perennial hematoma, so how and why this disease develops, bleeding into the tissues of the perineal area can cause hematoma formation. We have at least 500 cc pulled in the hematoma, maybe around the episiotomy site. Trauma during spontaneous labor. In other cases during of an episiotomy and delayed homeostasis or difficult or prolonged second stage of labor or both. So what are the symptoms of this perennial hematoma? So the main symptoms of the perennial hematoma are pain, a purplish lump near the edge of the anus, swelling, sensitivity to pressure, and difficulty in sitting. So bleeding can sometimes be a sign of a perennial hematoma, but it can only occur about 1 to 3 weeks after the lump.
For the assessment, assess for abnormal severe pain in the perineum, pressure in the perineal area because hematomas may feel like a small lump ranging in size from about a small raisin to a tennis ball. Sensitive bulging mass in the perineal area with discolored skin because hematomas looks like a blue bruise under the skin or dark purple collection of blood. Inability to void because of pain, decreased hematocrit and hemoglobin levels because of bleeding, signs of shock such as pallor and tachycardia, hypotension if significant blood loss has occurred. For the complications, hypervolemia and shock from extreme blood loss may occur, anemia and infection if left untreated, increased length of postpartum recovery period because of the pain and stress that the mother feels. Sepsis, this is the body's response to infection. This happens when an infection that you already have triggers a chain reaction throughout the body, and without timely treatment, this may lead to tissue damage, organ failure, or death. And lastly, dyspareunia or painful during sexual intercourse.
In most cases, treatment for small to mid-sized perineal hematoma focus on reducing pain and discomfort and letting the swelling heal on its own. Larger hematomas, which can be extremely painful, may require draining. However, this procedure results in a wound that needs a treatment. Due to this, doctor reserve the procedure for hematomas that cause significant pain. Doctor can administer a local anesthetic, make a small cut, and let the clotted blood escape, which brings quick relief of the symptoms. While it is important to keep this area clean, the wound from this procedure typically closes on its own within a few days. For small hematomas less than 3 cm are left to resolve on their own. Ice pack may be applied. Larger hematomas greater than 3 cm may require evacuations of blood and ligations of the bleeding vessel. Analgesics and broad-spectrum antibiotic may be ordered due to the increased chance of infection.
For nursing interventions and patient education, first, we have to monitor the vital signs of the woman periodically and to observe or evaluate for the signs of shock. Second, we have to relieve the pain of a hematoma by applying an ice pack on the perineal area. medicate with mild analgesics, and position for comfort to decrease the pressure on the affected area. Catheterize the woman if she is unable to void. Teach the woman the importance of eating a balanced diet and to include food high in iron. We also need to help the woman relieve voiding problems by assisting the woman to void if able to ambulate. However, if the woman is unable to ambulate, we have to assist her to sit on a bedpan with legs hanging over side of the bed. We also need to provide privacy and run water while the woman is attempting to void. Also, we need to encourage the woman to take vitamin supplements and take medications as ordered by the physician. And lastly, we have to instruct the woman to use the sitz bath to provide perineal comfort after the first 24 hours and at home. Sitz bath is a warm, shallow bath that cleanses the perineum.